This presentation is on multidirectional instability of the shoulder and the disablement model. My name is McCall Christopher, and I'm a graduate assistant with Indiana State University and the swimming and diving team. This project is assigned as a part of the doctorate in athletic training program at Indiana State University. What is multidirectional instability of the shoulder? The shoulder is the most mobile joint in the body. When mobility is too excessive, stability is lost. Without a combination of both mobility and stability, injury occurs. There is both traumatic and atraumatic instability. Traumatic usually surrounds one event that causes a dislocation or subluxation. And atraumatic is usually chronic in nature. The disablement model, according to the National Center of Medicine, Rehabilitation, and Research, splits disablement into 5 domains: pathology, or the cellular level of the injury; impairment, or the body system involved in the injury; functional limitations, or the whole person; disablement or disability and the person's relationship to society; and societal limitations, and meaning the barriers they have in participating in society. When thinking about a specific athlete or patient with multidirectional instability, I utilized the collegiate swimmer. So their pathology is the multidirectional instability of the shoulder. Their impairments might be increased range of motion, decreased stability, and an increase in pain. Their functional limitations might be they can't swim more than 500-meter freestyle without pain at a 50% effort. Their disability would be considered their inability to participate in swim practice or meets, causing them to be disconnected from their swim team. And their societal limitations would be the loss of athletic scholarship and educational funding, which might cause them to drop out of school or transfer to another educational institution. There are 3 different domains of prevention. There's primary prevention, which is focusing on the healthy individual and focusing on avoidance of risk factors. There's secondary prevention, which focuses on early detection and treatment of asymptomatic pathologies. This might be found in evaluation without actual symptoms occurring, while you would educate them on risk factors during this secondary prevention. And there's tertiary, which is limiting and increasing their additional impairment, functional limitation, and disability. So you're gonna focus on simply letting them do their daily life activities and so forth. So for the scenario that we talked about earlier, with a swimmer, a collegiate swimmer with multidirectional instability, their primary prevention would be using a screening tool to assess and beginning with strengthening and posture training. Also working on mobility of other joints, knowing that they're a swimmer and they have a high increase in work on their shoulders, that we would increase other joint mobility to take pressure off the shoulders, such as thoracic mobility. A secondary prevention program would be that they are showing beginning signs of pain or stability issues, and we would begin a strengthening program mixed with specific sports training. And then a tertiary prevention program would look at an athlete who already has all of the symptoms and is symptomatic for multidirectional instability, we would try to decrease pain, increase joint stability with strengthening exercises in order for the patient to complete their everyday tasks and slowly work them back into sport. Some risk factors you would identify in somebody with multidirectional instability could be predisposition, so they're relatively thin and lack any supporting structures or have some sort of weak ligamentous disorder. Their upper extremity sports participation would be a risk factor. How many years they've been participating in sport. If they've been participating since they were a child, they might have an increased risk of multidirectional instability. And if they exhibit weak rotator cuffs, possibly from previous injuries, they might be at a higher risk. Thank you for listening to this presentation, and I hope you learned a little bit more about multidirectional instability of the shoulder and the disablement model.